Hi, hello everybody. Welcome back to One Question a Day, our channel. The question that we are going to discuss is the histology of TMJ, especially the articular surface. So the first thing you have to do is add up the diagram and mark the parts correctly. That will include an articular zone, proliferative zone, fibrocartilage zone, calcified zone, and subarticular zone. So of this 4 is most important. So we'll go into this. The articular surface of the condyle and mandibular fossa are composed of 5 different layers of zone, the articular surface. Okay. First is the articular zone, which is the most superficial zone made up of dense connective tissue. Outermost functional surface. It is found adjacent to the joint cavity and forms the outermost functional surface. Unlike the superficial layers of the other synovial joint, this layer is made up of dense fibrous connective tissue rather than hyaline cartilage and is made up of collagen. The collagen fibers are parallel to the articular surface. The fibers are tightly packed and are able to withstand the forces of movement. Tightly packed and able to withstand the forces of movement induced by the condyle. Okay, and it is thought this fibrous connective tissue affords the joint several advantages over the hyaline. So it is mostly collagen in nature. It is generally less susceptible than hyaline cartilage to the effects of aging also. Hence, therefore, is less likely to break down over the time. It has also much ability to repair than the hyaline cartilage. The second zone is the proliferative zone, and it is mainly cellular, mainly composed of undifferentiated mesenchymal tissue. It is responsible for proliferation of articular cartilage and subsequent replacement, especially in response to functional demands placed on the articular surface during loading. The avascular, in the third zone is the avascular zone. It is the fibrocartilaginous zones that lacks blood vessels characteristically. Here, the collagen fibers are arranged in bundles in a crossing pattern, few in radial orientation. The fibrocartilage appears in random orientation, providing a three-dimensional network that offers resistance to compressive and lateral forces. This is the area that withholds the maximum forces. This has to be added in this. Next is the fibrocartilage zone made up of collagen fibrils arranged in bundles in a crossing patterns. Next is the calcified zone made up of chondrocytes and chondroblasts distributed throughout the articular cartilage. In this zone, chondrocytes becomes hypertrophic, die, are about to die and have their cytoplasm evacuated, forming resting cells within their medullary cavity. Chondrocytes produces collagen proteoglycans, or rather they secrete all these collagen proteoglycans, glycoproteins and enzymes that produce matrix. The articular cartilage is composed of chondrocytes and intracellular matrix. The other thing is the articular disc. Talking about the articular disc of the temporomandibular joint is a thin oval plate made up of non-vascular fibrous connective tissue, which is located between the mandible's condylar process and the cranium's mandibular fossa. Its upper surface is concavo-convex from before backwards to accommodate itself to form the mandibular fossa and the shape of the articular tubercle. The lower surface is in contact with the condyle of the mandible, hence concave. In its entire circumference, it is connected with articular capsule and in front of the tendon of the lateral pterygoid muscles. It is thicker at periphery, especially behind than at centers. The fibers of the disc is composed of concentric arrangement, more apparent at the circumference than at the center. This divides the joint into two cavities, the upper and lower, each having its own synovial membrane. The anterior portion of the disc attaches inferiorly to the anterior condyle and superiorly to the eminence by bending with the joint capsule. Posteriorly, the disc attaches superiorly to the temporal bone and inferior to the posterior condyle, also called as the bilaminar zone. Laterally and medially, the disc attachments blend into the joint capsules nearer to its attachment to condylar head. Clinical significance: the disc prevents the mandible from moving most posteriorly. Clinical significance of the entire part is fibrillation. The joint collagen fibers, when they disengage, you get defibrillation in direction. Then you have developmental abnormalities of condyle. Then you have autoimmune disease or sepsis causing the degeneration of the articular surface, leading to what we call as TMJ ankylosis. With that, we come to the end on the histology of TMJ. Stay connected with this channel to learn more.